So for denture wearers, what are their options when it comes to dental implants?
Great question, Randy. I often get patients come in and they have that exact type of question. So I'm just going to take it from like on the very basic level to more, more involved. So the very basic level would be a patient that comes in that's missing lower teeth. They've been wearing a denture and that denture is just loose. So we could put 2 implants, the denture snaps in. That basically just keeps it from falling out.
So it's what, a snap in, snap out denture?
Snap in, it's removable. The implants just kind of has a little snapping effect. And that's a huge benefit, if you will, from non-implants.
So no more adhesive.
No.
Can they eat with it?
They can eat great.
Okay.
The studies show, Randy, that someone that has a denture has 90% less efficiency than someone with a dentition. That's pretty significant. So we can eliminate that. So no adhesive. The downside to it is because there's no implants in the back, if you will, they can get seeds under it, and so they can still feel that, and it can move around in the back. So the next step would be we'd add more implants, and that just kind of distributes the load or the force, and it adds this more to kind of keep it in place.
Like what, 4?
Like 4 implants.
Okay.
4 implants
Snap
with
in,
the same
snap
kind of,
out.
it's still removable, and I had to have 4 implants. What my patients love about this, Randy, is that they don't have to hold back anymore. They don't have to worry about their teeth falling out. They can laugh out loud. They can be more involved with activities and not worrying about the denture falling out. We've all seen the YouTube clip of the skydiving grandmother with the teeth falling out. It's just not a possibility. Not that not all grandmas are skydiving, but that's just, eliminated. For those patients, Randy, that want to have non-removable teeth, in our practice, it's commonly we'll use 6 implants to serve as the foundation for that. And this is kind of like, I call it the Mercedes-Benz or Cadillac. These patients have very, very little limitations. They can eat almost anything they want. Anything you could eat with your natural teeth, you can eat with these. We have materials now that are just phenomenal. We're doing a lot of this with the zirconia. These teeth, they just don't wear. They look
could you
good.
bite like an apple or a carrot with your front teeth?
Absolutely, absolutely, yeah.
So no more dentures.
No.
You don't like dentures?
No, I don't like dentures because it's frustrating as a dentist. I can make someone the perfect set of dentures, textbook, by the book, everything perfect. And guess what? Sometimes they're just not happy. They just can't be happy, because would you be happy if you had some piece of acrylic in there moving around and causing sores in your mouth? And it's just a dated technology. My great grandmother had her teeth that she put in her glass, and if she were with me today, I could change her life. And I have a child. We talk about childhood memories. My personal experience was my great grandmother almost died on Thanksgiving Day at our dinner table because she was choking on food. Okay, this wasn't choking like, oh, I'm choking. This was like turning blue, something stuck, because she couldn't chew her food properly. I had to do the Heimlich maneuver on Grandma on Thanksgiving Day, and when you're 17 years old, and that's a memory. Now as a dentist, I look back and go, wow, I could change her life today. I could give her teeth that she could literally eat things properly.
What about the upper?
The amazing thing about the upper is when I have patients that have worn a denture for years, they have that acrylic, it covers their palate. They can't taste their food as well, the texture, it's just limiting. So when we do an upper, we eliminate that palate. They can now feel their palate again, the texture of their food. It just feels so much more natural to them. It's one of the best services that I offer patients.
Now we should mention also, you're one of these guys, I'm saying one of these guys. You lecture on this topic, you teach other dentists.
Yeah,
you're also a continuing education guy at all times.
Yeah. Randy, those of us that are passionate about what we do are always trying to learn more and more. And yeah, I lecture on the topic. I've been all over the United States, and it's given me opportunity to make some great friends and colleagues around the world. But what I've discovered is that, I'm in a profession with a lot of passionate people. Their dentists spend literally thousands of dollars of their own time and expense to just get better at what they do, to offer their patients better skills. And so when I go out and I lecture, it's not because, oh, I'm so this and that. It's like because I'm just sharing what's worked well in my practice with others, and what's brought a lot of passion and what's changed people's lives. And I love to, I love to share that.
So missing teeth, always dental implants? If you have a choice?
If I have a choice, that's absolutely.
And they're permanent.
Yeah. And the other thing that we don't, when you lose a tooth, what happens is you lose bone. Okay, if you take a tooth out and you looked at that site where that is, what you'll notice is that bone is going to shrink. And it shrinks initially quite a bit over the first year, and then it's a slow progression. When we put an implant into the site, it preserves the bone. So we're literally preserving bone and facial structure when we place dental implants. So it keeps the face from aging over the years. Because, you know, we've all seen that picture of someone when they take their teeth out, what happens?
Sinks in, yeah.
Yeah, why does their face sink in? Well, because their teeth were supporting their lips and their face, and what's supporting the teeth? So you start to take that all away, and then you start to get facial collapse.
I think
aging
you told me
face.
this. So even if you're missing one tooth or a couple teeth in the back,
Yeah.
that it kind of, the whole mouth starts to shift.
Yeah.
And
It's
you're
like a-
kind of headed toward expensive dental problems in the future.
Well, it's a domino effect. You take out one
that
tooth,
right?
and what happens is the other teeth start to drift and migrate into the space. And so by putting the tooth in there, we keep things, you know, the way they're supposed to be.